Hi, I am Murad. I am third medical student. Today, me and my colleague Hala will present our seminar about Barrett's esophagus, supervised by Dr.Zahraa Marwan. First of all, the esophagus is defined as a muscular tube that connects mouth with the stomach and pushes the food through the lower esophageal sphincter to the stomach. And the Barrett's esophagus, which is our concern, defined as a condition in which the tissue of the esophagus replaced by tissue similar to the intestinal lining, often diagnosed in people who have long-term gastroesophageal reflux disease or GERD. In about 10 to 15% of people with GERD develop Barrett's esophagus. In the United States, it is estimated that 5.6% of adults have Barrett's esophagus. However, estimates of the prevalence of Barrett's esophagus in general population have varied widely between 0.4 to 20%, depending upon the studies and the criteria that is used in the diagnosis. A Swedish study estimated on 1,000 randomly selected adults found Barrett's esophagus is developed in 16 individuals, with 5 of them demonstrating long segment disease. Now the question is, what about the pathogenesis of Barrett's esophagus? Okay, let's present it in the next video. I'm going to focus on the lower esophageal region. See, the food is pushed down toward the stomach through a series of muscle contraction called peristalsis, and the lower esophageal sphincter is acting as a barrier between the esophagus and the stomach. When functioning properly, the lower esophageal sphincter is normally closed. It relaxes briefly to allow the food to enter into the stomach and then quickly closed again. You know, the stomach contains a mixture of strong gastric acids that digest your food. When the lower esophageal sphincter is unable to close properly, then the gastric acid that present in the stomach can flow back and reflux into the esophagus. This will cause damaging of the esophageal lining, causing pain and discomfort. So this condition is called gastroesophageal reflux disease, or GERD in abbreviation. Let's take a closer look at the lower esophageal sphincter. Note the continuous flow of gastric acid reflexing back into the esophagus, and this will affect the normal squamous epithelium that present in the esophagus, and going to erode the normal mucosa and promote the infiltration with inflammatory cell, then the replacement of the normal squamous epithelium with metaplastic columnar epithelium that containing goblet cells, which is more resistant than squamous epithelium, and this condition is called Barrett esophagus. There are many causes that can result in acid reflux, started with weakness of the lower esophageal sphincter, patient with hiatal hernia where the upper few centimeters of the stomach slides back and forth between the chest and abdomen through the diaphragm, stress and anxiety, heartburn, trigger food, eating large meals, physical exercise, tight clothing and position. All these lead to lower esophageal sphincter dysfunction. Now, why is there so much interest in Barrett's esophagus? Actually, the reason is that it's associated with an increased risk of cancer of the esophagus, so it's considered a pre-malignant condition. But don't worry, this is not occur in all cases with Barrett's esophagus. The good news is that the cancer occurs in relatively few patients with Barrett's esophagus. Only about 0.5 to 1% of patients with Barrett's esophagus diagnosed with cancer each year. The type of cancer that occurs in patients with Barrett's esophagus is adenocarcinoma, which arises from the metaplastic intestinal tissue. But keep in your mind, the usual cancer of the esophagus that is not associated with Barrett's esophagus is squamous carcinoma, which arises from the squamous cell lining that is normally present in the esophagus. Now the gross morphology. Here we can see the residual smooth pale squamous esophageal mucosa proximally that interfaces with the light brown columnar gastric mucosa distally, recognized as chunks of red velvety mucosa extending upward from the gastroesophageal junction. And here we can see the gastroesophageal junction. About the macroscopical appearance, the upper photo was taken by endoscope, shows two areas. The light area on the left side is the squamous epithelium that is normally present in the esophagus. There are no goblet cells, which are the characteristic sign of Barrett's esophagus, so this area is not affected. And the darker area on the right side is the columnar epithelium with goblet cells. Here we can see the goblet cells with the nuclei and organelles located at the basal part of the goblet cell, while the acid-mucin containing granules located at the apical part of the goblet cells. And this condition called intestinal metaplasia with many cytological changes. This is another picture shows the intestinal metaplasia with different stains with many cytological changes that can predispose to cancer, including hyperchromasia, clumped chromatin, increase in the nuclear to the cytoplasmic ratio, high mitotic activity with loss of polarity. Sometimes the goblet cells may be indistinguishable from pseudogoblet cells, which are goblet-shaped gastric foveolar cells, but there are some characters specific to each of them. On the left side, the pseudogoblet cells are arranged as clusters, back-to-back or continuous array, with eosinophilic or pinkish cytoplasm due to the neutral leucine, while the true goblet cells on the right side are randomly distributed among the columnar epithelium, with the basal part is basophilic due to the nuclei and organelles, while the acid-mucin containing granules at the apical part is stained pale with hematoxylin and eosine stain. Also, we can use Alshan blue stain to differentiate between goblet cells and pseudogoblet cells because it is basic dye used to stain acid-mucin and the mucous substances at pH 2.5. And here we can see the goblet cells stained blue due to the acid-mucin, while the pseudogoblet cells demonstrate clear staining due to the neutral mucin. About the classification, Barrett's esophagus can be classified according to the degree of dysplasia and second according to the length involvement. According to the degree of dysplasia can be classified into no dysplasia, where there is no cytological changes that can predispose to cancer, low-grade dysplasia with few cytological changes, high-grade dysplasia with high cytological changes, and non-invasive carcinoma, invasive carcinoma. And according to the length involvement can be classified into short segment Barrett's esophagus, where 3 cm or less of the esophagus involved in the intestinal metaplasia, while the long segment Barrett's esophagus, where more than 3 cm of the esophagus involved in the intestinal metaplasia. There are many risk factors to get Barrett's esophagus and may include chronic heartburn and acid reflux, old patients who are more than 50 years, being a man, being white, being overweight can increase the risk of cancer by up to 3 times, smoking, using of anticholinergic medication, and finally family history of Barrett's esophagus or esophageal cancer. About the clinical feature, actually the changes that occur in Barrett's esophagus cause no sinus symptoms, but the sinus symptoms may be due to GERD and may include vomiting, dysphagia, chest pain, dry cough, heartburn, and feeding difficulties, particularly in those who are too young to explain their pain and discomfort.
I'm Thair, and I will start talking about how to diagnose Barrett's esophagus. There are 2 requirements for the diagnosis of Barrett's esophagus. The first is endoscopic evaluation. In endoscopic evaluation, we will see an abnormal pink or salmon-colored lining of the esophagus, as the darker area of pink color shown in this picture in the upper right side. This indicates intestinal metaplasia. and this pink area replacing the normal whitish lining of the esophagus, as we see also in this picture as light color area. The second is by microscopic evaluation of the biopsy of this abnormal lining, which shows the intestinal metaplasia including a mucus-producing cells called goblet cells. It actually could be treated surgically. There are three means for the surgical treatment. The first is choreotherapy. It's done by a catheter is guided to the site of abnormal cell through an endoscope. The physician sprays liquid nitrogen to the tissue to freeze it and destroy the cells. The second means is by radiofrequency ablation. A physician uses an endoscope to insert a thin tube or catheter with a balloon at the end. The balloon has electrodes on the surface that deliver energy, and because of these cells are inflated, the endoscope touches these abnormal cells, and physicians deliver enough energy to destroy these tissue by heat. The third means is by esophagectomy. To remove the abnormal or cancerous cells, the part of esophagus is removed along with a top part of the stomach, with nearby lymph nodes. The remainder of the stomach is put up through the hiatus and attached to the remaining of the esophagus. So, what are the risks of esophagectomy? They are dumping, infection, bleeding, and leaking, where the food moves more quickly from the stomach to the intestine, and if its progress surely will lead to the death. The other means for the treatment of Barrett's esophagus are photodynamic therapy and endoscopic resection. For prevention of this disease, there are forbidden food and allowed food. The forbidden foods are alcohol, coffee and tea, high-fat foods, chocolate, tomatoes and pepper, citrus or acidic fruits like oranges, grapefruit and lemons. Allowed foods are ginger, non-citrus fruit, fibers, oatmeal, egg white, and the patient should eat egg white only without egg yolk, which contain high fat contents. Vegetables like potatoes, cucumber, and green beans. There are some changes that the patient should do it in his lifestyle, like give up smoking, sleep with your head and shoulders propped up, sit up straight, avoid laying down for at least 3 hours after a meal, wear loose and comfortable clothing, eat small meals throughout the day, avoid heartburn triggers, and finally exercise regularly. At the end of our seminar, we want to ask you what's the type of cancer that is occur in Barrett's esophagus. If you know the answer, write it in the comments, and if you have any other question, write it also. And thank you for your watching and listening. Always remember, stay safe, stay at home.